the second hour here on the 13th of August, 2013. We're going to go right to the phones right away because we are cranked right up here. We're going to go to Virginia first and talk to Terry about high blood pressure. Hey, Terry, thanks for the call. Thanks for waiting. You are live.
Yes, Dr. Glidden, this is Terry. I've been listening to you and watching you, Dr. Wallach, for the past 3 weeks. And I want to know what to do for high blood pressure, stress, insomnia, anxiety, arthritis, and sinusitis.
Well, all of these things, interesting you should give me that list, right? Because with the probable exception of sinusitis, everything else has deep roots inside of a calcium deficiency. There's a saying in medicine, in diagnostic science, that when you're trying to figure out what's going on in somebody's body, right, when somebody presents with a certain set of symptoms, you think about the most common causes of the problem first before you start thinking about strange, rare, or peculiar causes, right? Hands down, the most common cause of high blood pressure is a lack of the mineral calcium and also magnesium in your body. Hands down, the major cause of an arthritic condition is a loss of calcium and other minerals in the body. Hands down, a problem with an inability to fall asleep and with a disrupted sleep cycle is not enough calcium and magnesium in your body. So for goodness sake, you are the poster woman for chronic calcium deficiencies, at least ostensibly. I mean, this is the first thing to think about, the first thing to consider. And, this is another problem with medicine, right? Because if you were to take these conditions to an MD, rather than just using their smarts, thinking it through, referencing the research that's been done, referencing the clinical work that's been done, they would, set you up with $5,000 of diagnostic discovery, which would, and then they'd give you drugs to manage the problem, none of which would fix it, which would be very expensive. And we wonder why we have a healthcare crisis in this country. We wonder why we're going straight to hell in a handbasket. Well, it's because MDs have the wrong perspective, bring the wrong perspective to bear, not only on their treatment of illness, but also on what to do with the patient when they walk into their office. So I don't need to see blood work. I don't need to have an ultrasound or a CT scan. I can advise you, just based on your symptom history, something to do for 90 days, a really good medical nutrition program for you for 90 days. And because this is a comprehensive plan, right, because we don't treat blood pressure, we don't treat arthritis, we treat people. There's a big difference. We're going to deliver to your body the nutrients it needs to fix itself. We're going to get the heck out of the way and see how far back the body bounces. It's that simple. So I can hook you right up here, Terry, with a pretty good program. How much do you weigh? What's your current body weight?
I weigh 155 pounds. I'm 5 foot, and I'm A blood type, and I'm 57 years old. Okay, very, very, very good. Are you on any special dietary kicks? Like, are you a vegan or a vegetarian or anything like that? No, I do the meats, and just started weaning back from the grains. Okay. I am on some Nature Sunshine supplements, which I've been on for the past 5 years. Yeah, and how's that? 2 different kinds of prescription drugs. Yeah, okay, so now, I don't mean to bash Nature Sunshine, but I will. I don't really mean to bash any other nutritional supplement company because a little bit of vitamins is certainly better than none. But my position is, and Dr. Wallach's position is, and many of my naturopathic colleagues' positions are, that when you're on board with the right vitamins and the right minerals and the right nutritional supplements, your symptomology disappears. So given the fact that you've been taking vitamins and you still have trouble means to me that the program that you're on is not effective. Otherwise, you wouldn't have the problem. And that's the same with the meds, right? And also understand that it's not your medical doctor's job, nor is it their inclination to fix your problem. It's not their job to cure it. Their job is to manage it with drugs. And, again, it's nothing wrong with a drug. I can prescribe drugs. Drugs are like guns. It's how the drug is used. It's how the gun is used that makes it good or bad. It's not the existence of it. So
we'd all be speaking British if it weren't for the gun. I mean, for goodness sake, we might all be speaking Japanese if it weren't for the gun. Who knows, right? It's not the gun, it's how it's used. It's not the drug, it's how it's used. So, my recommendation for you at 155 pounds would be, for 90 days, all right, so here's the recommendation. It's going to be 1 bottle of Beyond Tangy Tangerine 2.0 peach flavor. 1 Beyond Tangy Tangerine 2.0 peach flavored multivitamin. Beyond Tangy Tangerine 2.0 peach flavor nutritional supplement. 2 bottles of Osteo FX Plus. 2 bottles of Osteo FX Plus. That's O-S-T like Thomas, E-O, F like Frank, X Plus. Actually, it's beyond. I'm sorry. It's beyond Osteo FX Plus. 2 bottles of Beyond Osteo FX Plus. 1 bottle of Ultimate EFA Plus. 1 bottle of Ultimate EFA Plus. And 1 bottle of Glucogel Plus, Liquid Glucogel Plus, Liquid Glucogel Plus. And 2 bottles of selenium. 2 bottles of selenium. 1 bottle of Glucogel Plus, 1 bottle of EFA Plus, 2 bottles of the Osteo FX Plus, and 1 bottle of the Beyond Tangy Tangerine 2.0 Peach Infusion. Now, in addition to this, Terry, you must stop. You have to just jump in the ocean rather than sticking your toe in the water and checking it out. You must immediately stop eating all 10 bad foods. Now, you've done a really good job so far, but you need to take this to the next level. Because what we're attempting to do here is fill up your body's nutritional tank, so to speak, with these supplements, right? And if you're still eating a little bit of grain a couple times a day, a couple times a week, if you're still eating fried food a couple times a day, a couple times a week, if you're still eating sausage or pepperoni or bacon that has nitrates in it a couple times a day or a couple times a week, if you're still washing down lunch with a carbonated beverage a couple times a day, a couple times a week, this program is going to be slowed way down and you'll just get frustrated and it won't work. So really, in order to optimize the results that you can anticipate here, you need to completely eliminate all 10 bad foods immediately. And, it's kind of easier than it might appear to be because I'm not asking you to start doing something. I'm asking you to stop doing something. So I would really grab that bull by the horns, Terry. Get a hold of those nutritional supplements. And by the way, who was it, Terry, that brought you into Youngevity, that told you about this radio show or what we're up to?
Actually, I was like just going into different emails and stuff with Dr. LeBeau, Dr. Rima, and then I clicked on Dr. Caldwell because I do a lot of research on the top naturopathic doctors.
Very good.
And then I just noticed you there on the right-hand click, and so I clicked on, and then I started listening to you and Dr. Wallach.
Very, very good. All right, then let me give you a number to call where you can pick these supplements up at the wholesale price, and members of my team will facilitate that for you and make it easy and answer any questions that you have. That number is 855-347-3696, 855-347-3696. Tell them you spoke to me on the radio, and they will bring you into the light of medical nutrition, tell you how to take these nutritional supplements, and also hold your hand a little bit if you need that. Thanks so much, Terry. And call me back in a couple of weeks after you've started the program. Oh, and because of the blood pressure issue, right, the recommendation is keep taking your blood pressure meds as you always did. Start the nutritional supplement program. Take your blood pressure every day. And as you see the blood pressure numbers come down, go to a pharmacist, go back to an MD, heaven forbid, go to some health professional who can advise you as to a reduction program for the blood pressure meds, because as the medical nutrition works and your blood pressure starts to get healthy and strong and normalize on its own, if you continue to take the blood pressure meds, it's going to force your blood pressure to be too low. And that's dangerous as well. So you would be advised here to measure your blood pressure regularly once you start the program. And when the numbers come down, hook yourself up with a healthcare practitioner who can advise you as to how to wean yourself off of the blood pressure meds, because make no doubt about it, it is our job here to get people so healthy that they can safely, efficiently, and effectively stop all prescription meds, and that beats the poke in the eye with a sharp stick. That number, once more, 855-347-3696. Thanks for everything, Terry, and good luck. From Virginia to Canada, Dave's been on hold for a while. He's got a question about rheumatoid arthritis, I think. Hey, Dave, thanks for the phone call. You are live.
Hi, Dr. Glidden. I'm wondering about rheumatoid arthritis. I've been told that it's a virus that affects the joints. And just wondering, I know viruses are difficult to get rid of. How would you go about treating that? Have you heard of anything to deal with something called MMS? I've done some research on it. I just wondered if you have any take on that.
MMS, I'm not familiar with that. Can you give me a name instead of an acronym?
Yeah, it's a miracle mineral supplement. It was developed by Jim Humble.
Well, in the wonderful world of mineral supplementation, let me tell you this. Longevity's mineral supplements come from a mine in Utah, in southern Utah, which I have personally visited. And this mineral deposit is certified organic. It's been certified organic for over 30 years, and this mineral deposit has inside of it 77 plant-derived organic trace minerals. And, you know, there's minerals and there's minerals, and right next door to Longevity's mine, there's another mine, and the quality of the minerals in the other mine pale in comparison to the quality of minerals in Longevity's mine. Really, what it all boils down to, however, is results. You want to see results, we get really great results, and I'm encouraging you to stick with us. We're up against a hard break here, Dave. When we come back, I'll talk all about rheumatoid arthritis. Stick around, folks. And we're back, ladies and gentlemen. Dr. Peter Glidden here. Thanks for tuning in. Thanks for turning on. Thanks for broadening your mind. I hope that the information that you're receiving here is resonating with you. But remember, be warned, once you have grasped the truth, experienced the truth, you're in its velvet grasp forever. We're talking to Dave from Canada, who's still with us. Dave, are you still here?
Yes.
All right, buddy, thanks. So I looked it up over the break, and the Miracle Mineral Supplement promoted by JimHumble.biz is made from pool cleaning chemicals, right? Bromine.
Yes.
And chlorine. Yeah. So now, you know, what we bring to the table here, in Dr. Wallach's research, $25 million of federally funded research, 26,000 autopsies, 10 million blood chemistries and histopathologies. It was coordinated and engaged because of the Minamata disaster in Japan, when there was a environmental mercury contamination that killed thousands of people and injured tens of thousands of people, and completely made an entire generation of children born in Minamata have unbelievably horrible birth defects. And it was in response to the Minamata oblivion that occurred from mercury toxicity that Dr. Wallach was tapped to do this research. And the intention of the research was to uncover a link between environmental toxicity and health, and what that was all about, and so that's why they did it. And Dr. Wallach, he was running down the track, doing the research, doing the autopsies, doing the comparative studies, doing the blood chemistries, and trying to figure it out. And lo and behold, what they found out was that the amount of toxic crap that we're exposed to on a day-to-day basis is irrelevant as regarding our health, and that the only time environmental toxicity was really a big deal was when it was a gigantic exposure like Minamata, like 3 Mile Island, like Nagasaki, right? The normal day-to-day stuff that we're exposed to was irrelevant, but Dr. Wallach's research also uncovered something that they weren't even looking for. It uncovered the gigantic relationship between mineral deficiencies and health. Minerals, things like bromine and chlorine and calcium and strontium and zinc and americanium and hafnium and selenium and all this other stuff that, minerals most people haven't even heard of. are absolutely essential for the human body to function properly, There was even there was a United States government study that was done in the 20s that showed that minerals are absolutely 100% essential to maintain the status quo of the human being. However, when we're talking about minerals, it's more than 1, 2, 3, or 4. Dr. Wallach's research uncovered the need for 60 minerals. 60. That's why there are 90 essential nutrients, 60 of which are minerals. We've got 60 minerals, 16 vitamins, 12 amino acids, and 2 essential fatty acids. Now, you can make the argument that when you give your body a handful of minerals, it's better than nothing. You know, it's better to put air in your tires than not to put air in your tires. But it's also important to put oil in the tank and transmission fluid and power steering fluid and radiator fluid and spark plug wires and clean out the fuel filter, right? When you do everything, you get a much better response. So when you do Wallach's mineral supplement as opposed to anybody else's, you get a much better response because you're giving to your body a holistic nutrition, and that wins every time. Now, I have seen with my own eyes people with rheumatoid arthritis recover from rheumatoid arthritis with science-based, clinically verified medical nutrition. And even though we see this happen, we can't say we can cure it. For goodness sake, we don't even say that we treat it. And by the way, from our vantage point, it's not a virus that's affecting the joint. It's a little bacteria called a mycoplasma. It's called a mycoplasma. And so what we do to support and promote the structure and function of your joints in the face of a diagnosis of rheumatoid arthritis is, number one, eliminate foods that are pro-inflammatory. You've got to stop eating foods that are gumming up the works. Stop eating foods that are creating inflammation in the body, number one. Number two, give your joints the nutrients necessary for them to rebuild themselves, if it's possible for them to rebuild themselves, which often it is. And number three, strengthen your immune system so that it can have a fighting chance to rally and get on the other side of the infection. So we do that with 1 healthy bone and joint pack per 100 pounds of body weight per month, 1 bottle of selenium per 50 pounds of body weight per month, 1 extra bottle of Osteo FX Plus per month, 1 bottle of plant-derived minerals per month, and the immune system stimulant Killer Biotic. The best way to take that, in my opinion, 1 bottle per 100 pounds of body weight per month. Plus, eliminate the 10 bad foods. And if you do all of these things together, within 90 days, you should experience a noticeable, measurable, positive change. Check it out, Dave. I appreciate the phone call. Welcome back, everybody. Dr. Peter Glidden here on Tuesday, August 13th, 2013. Well, we had Mike Randolph on initially. Love it when Mike is here. And, you know, it's helpful to the listening audience if you hear other people rather than Dr. Glidden drone on and on and on about all of this because, you know, it's like one of those little crystals that you get to hang in the window and the sun hits it and you get all these rainbows going everywhere and you're right in the room. Well, everybody in the world brings a different take on what's going on to bear, and when you hear different points of view about the same subject, it helps to resonate inside of you. And you know, this is how we do it here, where we are a collective. We're like the Borg, except, you know, good Borg, not a bad Borg. Bad Borg, no biscuit. Yes, I am a geek. I am a sci-fi geek. Let's just put my cards right on the table here. And by the way, when Christmas is coming, if you'd like to send me any type of science fiction memorabilia, I would be more than happy to accept it. We're going to go right now to Miami and talk to one of our biggest contributors and staunchest supporters, Abby from Miami. Hey, Abby, what's going on down there in hot Miami?
Very hot. Thank you very much for taking my call again, Dr. Glidden. And I want to clarify that the reason I call so much is because I think people need to hear more testimonials. I mean,
well, I couldn't agree more. I'm with you 100%.
The main reason I got into longevity because of the testimonials I heard over and over and over. So I believe people need to call more. So I have 2 testimonials for my daughter, and I have 1 question after that.
Good.
Last week on Thursday, I had to leave work and come home because my daughter was crying in real bad pain. She was even kind of like trembling and shaking. And I thought she had a bug in the ear because I had it before, and I know how painful that is. So we had to take it to the doctor. I said, if it's a bug, we need to get it out. So we went to the doctor. He looked inside the ear, and he said, no, there is no bug, but there is an infection. Okay. He gave us a prescription for antibiotics. You know, it's in the garbage. I threw it in the garbage. So I knew already what to do. And, I gave my daughter a killer biotic capsule. I put her in a formula that she drinks every day. I gave it to her, and she went to sleep. 4 hours later, she woke up, no pain, just playing all night, the entire night, like nothing happened.
Now,
and
tell the listening audience how old your daughter is, Abby.
2.5.
2.5 years old. By the way, folks, if you're listening, if you're watching to the live video stream through Google Hangout, which you can do by accessing my website, you're going to see a remarkable picture of Abby, the person that we're talking to live from Miami now, a before and after picture of Abby and, his own pictorial testimonial here. Quite a remarkable thing that's happening down there. So she had a bad ear infection, and in 4 hours from one dose of killer biotic, she's completely over it. Is that what you're telling me?
Yeah, the pain disappeared. She didn't have any more pain because she didn't cry again. So maybe she has some itching or something, but no more pain because she stopped crying.
You gotta love it. Now, well, just imagine. All right, so let's run with this thought meme for a minute here. Imagine what would happen if every household in Miami knew what you now know. Can you imagine how much money families would save by not having to bring their child to the emergency room, by not having to bring their child to the pediatrician, by not having to bring their child in for, the doc-in-the-box clinic on the side? Can you imagine how much time, how much frustration would be eliminated here just from this one simple solution? I mean, this is a big deal. Oh, it's just a little ear infection. Well, it's the tip of the iceberg, folks. It's the tip of the iceberg. What we bring to the table are knowledge that helps you to become safely, effectively, and efficiently your own doctor. Now, I'm not encouraging you to do open heart surgery. I'm not encouraging you to stitch up a wound. I'm not encouraging you to try to, fix an epileptic seizure. But what I'm saying is, for most of the conditions that most people go to the doctor for most of the time, science-based, clinically verified medical nutrition is what you need, not a visit to the MD. All right, Abby, what next?
Well, after that, I started putting a couple of drops of colloidal silver inside the ear for a couple of days, and then I'm giving her 1 kilo biotic a day, so probably for like 10 or 7 days until that clears completely. Well, the other testimonial, it's when I started longevity, my daughter had been suffering. Actually, she wasn't suffering. The parents, we were suffering. She didn't know how to suffer, probably. She had real bad baby acne, and I didn't even know what it was. She would develop kind of like acne all over the body, and that started when she was like 3 or 4 months old until I found longevity about a year and a half later. And I called. I didn't even call you. I called somebody else. I called Ashley. And she told me to get the 90 essential nutrients and give her make sure she got the essential fatty acids. And I was using cod liver oil and a bunch of other stuff. So I kind of like doubted doing what you said, I have to be honest, because I was giving her essential fatty acids and the best in the world, to my knowledge, at that moment. And she said, believe me, trust me, please do that, and you'll see results. And I did it. I ordered, I started her, and I waited a few days. The acne didn't clear, so I called her back, which is something very important, I believe people need to know. If it doesn't work, call back, because you need to tweak a little bit. So I called back, and she said, well, give her 2 essential fatty acids and keep the rest according to body weight. I did that, and in less than a week, the entire acne disappeared.
And how long had the child been suffering with it?
About a year and a half.
Year and a half. And how many? Yeah. How many health conditions have you recovered from? Oh, by the way, folks, we're not exaggerating here. Ashley, I think, is with us right now in the chat room, and she can look up when Abi was here before giving his testimonial. We have it recorded. You can search it in the archives. But, Abi, how many health conditions have you recovered from with Youngevity?
Close to 30 conditions.
30 conditions. And how long did it take for you to get over those 30 conditions?
Less than 1 year.
Less than 1 year. Look, ladies and gentlemen, I mean, this is it. This is where the rubber hits the road. It's results, 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 and then we have a nice heaping topping of results. I don't know who the callers are. Well, I know who Abi is, but we haven't spoken since the last time that Abi called. We don't have behind-the-scenes conversations. We don't have anybody prompting any of the callers to say anything. This is all as fresh and as raw and as live as it gets. This is it, folks. We bring to the table science-based, clinically verified medical nutrition protocols which are developed by one of the most lauded naturopathic physicians in the world, and certainly the most researched naturopathic physician in the world, Dr. Joel Wallach. This stuff works better than anything I've ever seen. Anything that I've ever seen, and I've been a licensed naturopath for over 20 years, over 2 decades. There's no arguing with results, and that's what we consistently get here all of the time. Now, Abi, let's be honest again here. Let's take it to the next level here. Given your remarkable success, 30 conditions in 1 year, and I'm looking at your before and after picture here on the website. Remarkable. What's it like in your life getting people to try Youngevity? Is it easy? Is it difficult? What's it been like down there in Miami?
It is simple because the system is simple. It's not easy because people have so much wrong information in their brains. And when people say brainwashing, I say I need a power wash to get all the dirt that's remaining in my brain. That's what I need, a power wash. And, I constantly tell people, if what you're doing is not working, why don't you try something else? Some do, some don't do. I do the best I can. It is easy if you follow the system. And at the beginning, I didn't follow the system, and I struggled. I'm getting a little better now because I'm following the system. So people need to follow the system.
Gotta love it, ladies and gentlemen. And there's Abi with us. Abi, it's always a pleasure having you here. Call us back anytime. I appreciate everything that you're doing down there in Miami. And, by the way, Abi and his wife, Donis, right here on the Genesis Communication Network are going to have, in a few weeks, I hope, the first all-Spanish Youngevity radio show. All Spanish. Abi is of Cuban descent, Cubano. As are most people in Miami. There's a big need. There's a big cultural void that we can fill in Miami, quite frankly, in the Northern Caribbean, by bringing our message of science-based, clinically verified medical nutrition to anybody who has ears in Espanol. And I'm really excited for that to be rolled out. I will keep you posted as to when the initial show is going to start. Now, I'm going to do something that I don't normally do here. We're going to take a text message. I have a Youngevity distributor up in Canada. His name is Corey, and Corey sent me this text earlier today. By the way, if you're a member of Team Glidden, this is what you can do. If you are a subscription holder to my online health recovery program, which makes you a Dr. Glidden insider, You can send me text messages. You have access to live chat a couple hours on the Internet every week. You have access to live health recovery webinars. You have access to live introduction to longevity webinars. For goodness sake, I don't know what you're waiting for. Please visit fireyourmdnow.com. That's fireyourmdnow.com and sign up for my online health recovery program. I pulled up a little blurb about that right now. If you're watching this live, if you're watching the live video stream, there it is. Check it out. It's $20 a month, $195 a year. You can cancel at any time. You can become a member right now, folks. You can become a member right now. And if you are a member right now, you'll have access right now to over 80 hours of archived health webinars. So if you listen to the stuff that we talk about on the radio and you're just itching for more, well, let me scratch that itch with my online health recovery program, month by month or year by year. You decide. Check it out. It's right there, fireyourmdnow.com. That's fireyourmdnow.com. The text I have is from an elderly gentleman in Corey's group who has been diagnosed with a Bell's palsy of the 6th cranial nerve. A Bell's palsy of the 6th cranial nerve. It's pulling one of his eyes to the corner of his face. Oh, my God. Stick around. I'm going to tell you what we're going to do for that when we come back. I am Dr. Peter Glidden, and this is Fire Your MD Now. Welcome back for the final segment here of Fire Your MD Now. I misspoke a few minutes earlier. It's not a Bell's palsy. It's called an eye palsy, or just the 6th cranial nerve palsy. There are nerves that come directly off of your brain which go to your eyes, ears, nose, mouth, and throat. They're called the 12 cranial nerves. And to get to those anatomical structures in your body, those nerves have to go through tunnels in the skull. Remember, the skull is a hard bone. And in order for the nerve to get to your eye, ears, nose, mouth, or throat, or wherever the heck it's going, it has to go through a little tunnel. Well, one of the nerves, the 6th cranial nerve, is called the abducens nerve. You know, it's a fancy schmancy doctor talk, right, to make you think that their superior intelligence is like, you know, just this side of godliness. The abducens nerve controls one of the muscles in your eye. And when the signals to the abducens nerve are messed up, your muscle gets weak, and so the eye tends to get lazy. You get a lazy eye, and the eye tracks to the outside of the eye socket, right? So, you know, it looks like it's kind of the opposite of being cross-eyed, except it's just one eye. And it's called an abducens palsy. So from our point of view, what is it that causes this? Because we got to know what it is that causes it so that we can try to get on the other side of it, right? Well, the thing that causes this from our point of view, presumptively anyway, which is borne out by clinical experience and also by autopsy, is when your skull bone starts to lose nutrients, especially minerals. When the skull bone starts to lose minerals, the little tunnel that the cranial nerves are going through, in this case the abducens nerve, it starts to collapse because it's losing its structural integrity. When the tunnel around this nerve starts to collapse, the body puts connective tissue inside the tunnel to shore it up and to keep it from caving in. Just like when you're digging out of the stalag, you got to support the tunnel with, you know, wood timbers, or it's all going to cave in all around you, right? So now remember, it should just be an open, clear tunnel, but now there's connective tissue inside of it, and when you get connective tissue inside of it, invariably it will rub up against the nerve. So if it rubs up against the 6th cranial nerve, then the signals to this eye muscle get funky and you get a lazy eye. If it's the nerve that goes to your inner ear, which controls your orientation in space, you get chronic vertigo. If it's the nerve that goes to your eardrum, you get ringing in the ears. If it's the nerve that goes to the muscles in your face, you get a drooped face called a Bell's palsy. If it's the nerve that goes to your throat box, your larynx, your vocal cords, you get chronic hoarseness. It's all the same thing from our point of view, osteoporosis of the skull, which sounds pretty bad, but it's not really, because it's just a symptom that your skull bone has run out of the nutrients that it needs to support and promote itself. So what do we do to assist here? Well, we would need to give your skeleton more minerals, because the head bone's connected to the neck bone's connected to the... You know how it goes, right? Your skeleton is all connected, as is everything in the body. So what we do here is support and promote your musculoskeletal system. Support and promote the structure and function of the musculoskeletal system. The recommendation, do the healthy bone and joint pack, 1 per 100 pounds of body weight per month. 1 bottle of selenium per 50 pounds of body weight per month. Selenium is very important here to help the body lay down the minerals, and glucogel must be dosed at 1 capsule per 10 pounds of body weight per day. You may have better bang for your therapeutic buck in elderly people with the liquid glucogel plus, and that's dosed at 1 bottle per 50 pounds of body weight per month. 1 bottle per 50 pounds of body weight per month. Also into the bargain, once you've calculated the appropriate stuff, add 1 bottle of OsteoFX Plus and 1 bottle of plant minerals or the Cherry Mints. 1 bottle of OsteoFX Plus Extra and 1 bottle of the plant minerals or the Cherry Mints. This is what you need. More minerals, and I think the liquid glucogel is appropriate. And also the CM cream, which is part and parcel of the Healthy Bone and Joint Pack. If you rub it on the temple, slather it on the temple of the eye that's affected, it may reach inside and calm down the inflammation, because the nerve that goes to this eye is right here. I mean, if you drilled a hole right here through your temple, you'd hit the abducens nerve. So lather up the temple with the CM cream and see if that gives you traction momentarily while we're waiting for the medical nutrition to take hold. How about that, ladies and gentlemen? That's how we do it right here on Fire Your MD Now. Please visit the website of the same name and sign up for Youngevity. I can't wait to meet you in person. I'm Dr. Peter Glidden. See you next time.